Hello, my name is Kelly Pretorius. I am a nurse practitioner and I work in the surgery trauma department. I knew my whole life I wanted to go into healthcare. I used to round with my dad growing up, and so I would actually go with him to the hospital. And my mom is a nurse, so early on I knew I wanted to be a nurse practitioner, so it was kind of in our blood. I moved here to get my PhD. So I did my undergrad at University of Texas and then moved back to get my PhD, and my background fit really well with surgery trauma. So I've done emergency department, orthopedics, inpatient hospitalist, and so surgery was kind of a perfect fit since we're often in the ICU setting and also in the ER doing consultations. And it's a wonderful group of surgeons and a wonderful group of nurse practitioners that I get to work with. And we emphasize education and guidelines and whatnot, so it's a really wonderful team to be a part of. I personally try really hard to emphasize play and really look at the patient that I'm taking care of and make it a fun exam. So if I'm seeing you in the ER or I'm seeing you in clinic for something scary that's happening, I try to kind of bring it down a notch and make it a play. So on my stethoscope, for instance, I have little toys that I use to kind of distract the kids, and the kids can hold that when I'm doing the exam. And when I have students with me, I try to really emphasize how important that is, and also making sure that the parents know we are on your side. And so I always really listen to the parents before I even examine a child and really try to spend time with them so that they know we're there to care for their child. And I always tell parents they know their kid better than anybody else, and I always will defer to their expertise over my expertise. I have a very strong interest in global health, and so I had the opportunity to work in Africa. I was in Tanzania for a couple of months and worked on the inpatient wards there, and did a lot of outpatient reach with AIDS and teaching and trying to help pediatric AIDS and HIV at that point. I've also been to Honduras and done medical outreach there. I'm currently getting my PhD in nursing, and it is a focus on infant mortality. And so my research is focused on how do we reduce infant mortality, and I'm focusing specifically right now in the United States. I do precept a lot of students. I also do some research and teach too. And then I have a 2-year-old and a dog, and so on weekends we're pretty much at Zilker Park or hiking and kind of exploring all that Austin has to offer.